Now to growing alarm about some drug shortages across parts of the country.
In the U.S., we are still seeing a shortage of commonly prescribed antibiotics.
And right now, many Americans are having some trouble finding high-profile prescription drugs.
Get ready for a shocking truth that will shake the foundation of America's healthcare system. Accessing vital medications, antibiotics, and painkillers has become a nightmare, leaving patients and healthcare personnel in dire situations. In this video, we'll uncover the alarming reasons behind America's crippling drug shortage crisis, revealing the dark underbelly of the healthcare system. Hospitals are struggling to keep up with demand, and the consequences could be devastating for millions of people. Are you ready to discover the truth about the collapse of America's healthcare system? Join us as we reveal what the crisis means for the future of healthcare in America. You know what they say, life is a roller coaster. But when it comes to medicine shortages, it's less of a thrilling ride and more of a nightmare you can't wake up from. Ever heard the phrase health is wealth? Unfortunately, this phrase couldn't be farther from the truth for many Americans. It's unthinkable that America would leave its citizens hanging in the balance. But that's exactly what's happening with the drug shortage crisis. A catastrophe putting lives at risk every day. It's not just about medicine shortages. It's about people's lives being put in jeopardy. Imagine needing medication to treat a chronic illness, only to find out it's out of stock. You know, it's not just a headache when you run out of your favorite painkiller. It's like trying to put out a fire with a water pistol. It's an uphill task for healthcare professionals and hospitals in general. Doctors make difficult decisions about who gets the treatment and who doesn't. They may have to prescribe alternative medications that may not be as effective as they should, or may have crucial contraindications despite having the same efficacy. Other times, they just delay the treatment altogether. Imagine a delay in treatment for a life-threatening illness. In certain situations, where these alternatives are not available for these life-threatening conditions, like cancer, hospitals are forced to ration drugs. As a result, this leads to an increase in drug costs, which may not be worth it, and also decreased quality of care for patients. It's an absolute nightmare for hospitals. They may have to cancel procedures because they don't have the necessary medications on the ground. Patients are left to experience increased pain and prolonged hospital stays. And of course, let's not forget about the financial burden that comes with extended hospital stays. Like a relentless predator, the tentacles of the supply chain continue to create a complicated web of challenges throughout the American system. The healthcare system has not escaped unscathed, as pharmaceutical companies may be shutting down operations. The recent closure of Acorn Pharmaceuticals, a renowned Midwest-based pharmaceutical company, has sent shockwaves throughout the area. With a reputation for producing various life-saving cancer treatments, the sudden bankruptcy and subsequent shuttering of their operations have left cancer patients in the area in a tough spot. Imagine these individuals left to navigate a shortage of treatment options at a time when they need it the most. Over the past 10 years, the American Society of Health System Pharmacists tracked 200 different drug shortages daily. However, the medical community is leaving no stone unturned to ensure scarcity does not affect the well-being of their patients. Hospitals are carefully monitoring the drug supplies and working together to share resources. The healthcare heroes are waging a battle against time to keep patients healthy and on the road to recovery. Just as cancer patients depend on life-saving treatments to manage the condition, folks with ADHD rely on medications like Adderall to lead a functional life. And yep, if you guessed right, the shortage of this drug causes a challenge to patients. Well, tickle my fancy. According to the FDA, the country is currently experiencing a shortage, which started with some manufacturing hiccups last year. But now it's gotten more complicated with increased demand. But what do you expect in the face of limited drug availability? Although the FDA projects an end to the shortage by the beginning of April, patients are advised to always consult pharmacists for generic alternatives and ensure they obtain the real deal from reputable sources, such as their local pharmacy. On the other hand, it's mighty peculiar to think that a pharmacy could ever run out of a drug as crucial as albuterol. This inhalation solution is a godsend for people struggling with asthma and other respiratory issues. You'd reckon the shelves in drugstores would be stocked to the brim with it, but alas, It seems like the shelves are all too often bare. The availability of supply is affected by the closure of one of the key manufacturing facilities in the Chicago region. As a result, the supply chain has been disrupted and albuterol is becoming increasingly scarce. The liquid form of albuterol, mainly used for treating children, is affected. Now here's the thing. The aftermath of COVID-19 and RSV continues to have a domino effect on our society. The healthcare system is pushed to the brink by a surge and resurgence of respiratory illnesses and viruses. Many of them do require albuterol for treatment. Doctors manage supplies and use alternative medications for treatment. Sure, there might be a reason behind the scarcity of critical care medications. Inexcusable, but understandable nevertheless. But hey, when it comes to everyday antibiotics and generic drugs, it's frustrating to think that we're running out of them too. Come on, we're pushing our luck too far at this point with prescription drugs. Did you know that antibiotics, some of the oldest pills in modern medicine, are relatively inexpensive to produce? But there's a catch. This low cost does come at a cost. Manufacturers may not see a strong incentive to invest in maintaining a robust supply chain for these drugs. And you know what this means? Shortages or disruptions are liable to happen. The production of these antibiotics is sometimes mysterious, shrouded in layers of regulation and technical jargon. This lack of transparency can contribute to concerns about the quality and safety of these drugs. Once again, the dreaded COVID is a contributing factor to this problem. It seems the FDA has its work cut out for them. A focus on infrastructure, inspections, and oversight to improve manufacturing quality. The generic drug isn't left out. They make up 90% of all medicines sold in the US. Reports have it that from 2013 to 2017, a significant number of drugs went into shortage. And what's interesting is that 67% of those affected were generic, with a median price tag of fewer than $9. Even more intriguing is that these drugs have been around for an average of 35 years. Take, for instance, a children's hospital in Philadelphia. They are now facing a shortage of the most essential drug to treat a horrible side effect of lead poisoning in children that cause brain swelling. Do you remember Acorn, the powerhouse in the pharmaceutical world we talked about earlier? It seems like they've once again managed to grab the spotlight. They are the sole producers of a crucial drug to treat this side effect. The drug produced exclusively has suddenly vanished from the market due to its recent shutdown. The big question: what happens to children suffering from lead poisoning? Can you imagine the chaos and desperation that are unfolding as we speak? One option is for government to offer subsidies, and another is to treat the generic drug industry as a public utility. But with these solutions come concerns about the impacts of profits and investments. According to Senator Gary Peters, over 90% of the critical ingredients in injectable medications are manufactured in China and India. This dependence on foreign countries for vital drugs puts patients at risk, as any disruption in the supply chain could lead to shortages or even dangerous treatment gaps. And that's not all. Senator Rand Paul has pointed the finger at the FDA, accusing them of price control measures that only exasperate the situation. As tensions between the US and China continue to rise, the US finds itself in a precarious position, reliant on foreign countries for crucial ingredients. It's a concerning reality, and one that should give us all pause. Senators have taken action to address this issue. Although bringing drug manufacturing back to the US is being discussed, the low cost of these drugs presents a unique challenge. Let's face it, the drug shortage crisis in the US is not just another news story. It's a real crisis that affects us all. But there is hope. By demanding transparency, pushing for domestic manufacturing, and investing in our healthcare system, we can take back control of our medication supply. It won't be easy, but we're Americans, and we know how to roll up our sleeves and get the job done. So let's start now. Let's work together to build a healthcare system that puts patients first, and one that isn't held hostage by foreign countries. We owe it to ourselves, to our families, and to future generations. Thank you for watching. and let's keep fighting for a healthier, stronger America.